Have you ever felt a sudden pain or burning sensation in your chest and wondered if it was more than just heartburn? What if it was something more serious? In today's video, we're breaking down everything you need to know about hiatal hernias, from what they are and why they happen, to symptoms and treatment options that can help you take control of your health. Stay tuned to find out how to recognize the signs and what you can do to manage this condition. What is a hiatal hernia? A hiatal hernia occurs when part of the stomach pushes up through the diaphragm into the chest cavity. The diaphragm is a large muscle that separates your abdomen from your chest and plays a crucial role in breathing. Normally, the stomach stays below the diaphragm, but in the case of a hiatal hernia, a portion of it bulges through an opening called the hiatus. Types of hiatal hernias. There are two main types of hiatal hernias, sliding and paraesophageal. Sliding hiatal hernia, this is the most common type, where the stomach and the section of the esophagus that joins the stomach slide up into the chest through the hiatus. This type can move back and forth between the chest and the abdomen. Paraesophageal hernia, this is less common but more concerning. In this type, a portion of the stomach pushes through the diaphragm and sits next to the esophagus. This type can lead to more serious complications because the blood supply to the stomach can become restricted. Causes and risk factors. So, what causes a hiatal hernia? While the exact cause isn't always known, several factors can increase the risk. Age. The likelihood of developing a hiatal hernia increases as you get older, especially after 50. Obesity. Excess weight puts pressure on the abdomen and diaphragm. Pregnancy. Hormonal changes and pressure from the growing baby can contribute. Heavy lifting. Repeated strain on the abdomen from heavy lifting or intense coughing can also be a factor. Genetics. A family history of hiatal hernias may play a role. Additionally, injuries to the area, congenital abnormalities, or increased pressure in the abdomen, due to situations like persistent coughing or straining during bowel movements, can contribute to a hiatal hernia. Symptoms of a hiatal hernia. Many people with a hiatal hernia may not experience any symptoms at all. However, when symptoms do occur, they can include heartburn, a burning sensation in the chest due to stomach acid moving into the esophagus. Regurgitation, the backflow of food or liquids into the mouth. Difficulty swallowing, this can be due to the esophagus being compressed. Chest pain, sometimes mistaken for heart-related pain, but it's due to the hernia itself. Belching, excessive belching is common. Feeling of fullness, even after eating a small amount. Shortness of breath, due to the stomach pressing against the diaphragm and lungs. If you're experiencing any of these symptoms persistently, it's essential to consult with a healthcare provider for an accurate diagnosis. Diagnosis of hiatal hernia. Diagnosing a hiatal hernia typically involves a combination of the following. Barium swallow X-ray. You drink a special liquid that coats your upper digestive tract, allowing the radiologist to see the shape and position of your esophagus and stomach. Endoscopy. A thin, flexible tube with a camera is inserted down your throat to examine the inside of your esophagus and stomach. Esophageal manometry. This test measures the rhythmic muscle contractions in your esophagus when you swallow and the coordination and force exerted by the esophageal muscles. Treatment options. Treating a hiatal hernia depends on the severity of your symptoms and the type of hernia. Here are the most common treatment approaches. Lifestyle modifications. Dietary changes. Avoid trigger foods such as spicy, acidic, or fatty items. Eat smaller meals more frequently. Weight management. Losing excess weight can reduce abdominal pressure. Sleeping position. Elevating the head of your bed can help prevent acid reflux at night. Medications. Antacids, to neutralize stomach acid. H2 blockers, such as ranitidine to reduce acid production. Proton pump inhibitors, PPIs, like omeprazole, which block acid production more effectively. Surgery. If lifestyle changes and medications do not alleviate symptoms, surgery might be recommended. Nissen fundoplication is a common procedure where the top part of the stomach is wrapped around the lower esophagus to tighten the hiatus and prevent reflux. Minimally invasive surgery. Laparoscopic surgery is less invasive, offering shorter recovery time and less postoperative pain. Complications if left untreated. If a hiatal hernia is left untreated, especially a paraesophageal type, it can lead to serious complications such as strangulation of the stomach, also called volvulus, where the blood supply is cut off, leading to tissue death. Severe GERD, chronic acid reflux can damage the esophagus. Esophagitis, inflammation of the esophagus. Esophageal stricture, narrowing of the esophagus due to scar tissue. These complications can lead to significant health issues and require immediate medical attention. Understanding hiatal hernia is the first step toward managing and preventing its complications. With the right lifestyle changes, medical treatment, and professional guidance, most people can live comfortably and avoid severe outcomes. If you found this video helpful, please like, subscribe, and share to help others learn more about gut health and wellness. And don't forget to hit the notification bell for more informative content.